chronic pain is a very big problem. In fact, what many doctors have told me is that the incidence of chronic pain is much more than the incidence of even heart disease and cancer and all that. But unfortunately, because we are all suffering and it doesn't usually kill, people don't give much importance to chronic pain. But now chronic pain is getting more and more importance. So now the next topic which I will be talking you to is about what is called spinal cord stimulation. I am Dr. Ravindranvenkatraman. I am a neurosurgeon based in Chennai and I am focusing on functional neurosurgery. The spinal cord stimulation is actually, you can stimulate the spinal cord to control the pain of various conditions. There was actually a theory called the gate control theory of pain, which was proposed many years back, which said that there are so many gates in the brain and the spinal cord which close when you have a pain, so that you don't feel the impact of the pain. In fact, I'm sure many of you have seen people with headache doing like this. Why they do this? Because this is pressure. There is headache, pain, this is pressure. When you put pressure, at least theoretically some of the gates are closed so that you don't feel the pain as much as as it should. Again, suppose you are walking on the room and your leg hits the wall or chair or something. What do? You do like this. Again, this is supposed to close the gates so that the pain is not felt much by the person. Similarly, we use electric current to control or reduce the impact of the pain in many conditions. The commonest conditions which we use is what is called failed back surgery syndrome. So what is this failed back surgery syndrome is, somebody has a back pain, he goes and gets operated for the back pain. I am not going into the surgical part of it, but unfortunately either the pain does not go away or the pain comes back with a much more severity. This is called failed back surgery syndrome. In fact, the name implies failed back surgery syndrome. Again, the other conditions, there are other conditions. Now there is one condition called refractory angina. That is, I am sure all of you know of angina. Angina is pain of the heart, pain from the heart which is felt due to reduced blood supply of the heart. And angina always happens in some people, and there are many ways of treating angina, as you know, bypass surgeries, angioplasties and all that. But there always remains a small percentage of patients who will not be good candidates for any of this. So these patients either before or even after a bypass surgery still have angina and other limiting effects of their ability to exercise tolerance and all becomes very less. Similarly,